Welcome to the 2022 Canadian Alliance of Nurse Educators Using Simulation CanSim webinar series. Before we begin, we would like to take an opportunity to profile the launch of the new CanSim website.
Looking for high-quality clinical simulations and virtual simulation games to share with your students without the high cost often associated with commercial products?
As co-presidents of CanSim, we are excited to launch the newly revised CanSim website, where you can find easy-to-navigate resources to support your teaching and professional development.
At CanSim, we are committed to excellence in simulation-based education and research. Our core values are collaboration, mentorship, innovation, and scholarship.
Drawing upon the clinical expertise of nurse educators from across Canada, the US, and internationally, we've created a repository of over 160 high-quality virtual simulation modules and over 80 peer-reviewed in-person scenarios available in English and French. New modules are being added regularly.
Simulations are searchable and easily navigated by clicking on simulation categories. This includes community, mental health, med-surg, maternal child, and so many more types of games. We also offer a unique blend of faculty development resources, including debriefing and student mentorship.
CanSim offers monthly webinars, simulation design and facilitation workshops, virtual simulation workshops, and we offer the opportunity to participate in the research interest group. We work together to support each other to maintain excellence in nursing education through the use of simulation.
Please visit our website to find out more about how you can become a member and enjoy the many benefits that CanSim has to offer.
Today's webinar will be presented by Ruth Schofield. Ruth Schofield is an assistant clinical professor at McMaster University. She is an experienced educator with community health nursing curriculum development, implementation, and evaluation, having taught at both McMaster University and Western University. Her research activities focus on community health nursing, nursing education, and mental health. She has published several peer-reviewed articles and authored several textbook chapters. Ruth has over 23 years of public health nursing practice experience in frontline and management positions and in various programs. She's been the chair or general member on several provincial and national boards. Most recently, she was a member of the Cause and Accreditation Bureau and is currently a member of the Cause and Community Education Interest Group. Ruth has led several national projects in the development of standards, competencies, and guidelines for community health nursing education and practice. Welcome to the CanSim webinar, Developing Public Health Nursing Competencies Through Virtual Simulation Games. I'll just provide a very brief overview of the project and then let Ruth take over. Although the pandemic has created many challenges, there have also been many opportunities created through the world of innovation in nursing education, like virtual simulation games. The future integration only strengthens preparation in public health for undergraduate nursing students. It has been an amazing honor and incredible journey to work with this team in developing virtual simulation pedagogy. With the dedication and commitment of over 50 individuals, including CAS and staff, nurse educators, public health nurses, family, friends, students, volunteers, the 3 games created through this grant will be profiled. In this webinar, Ruth will share this learning journey. I am pleased to identify the project collaborators. McMaster University, which is the project lead, the University of Ottawa, Queen's University, the Canadian Alliance of Nurse Educators Using Simulation, CanSim, and the Canadian Association of Schools of Nursing, COSN. This project was made possible with funding from the Government of Ontario through an eCampus Ontario grant supporting the development of virtual learning strategies.
The webinar learning outcomes are to identify the public health educators and practitioners involved with the production, describe the development of these virtual games, examine the best practices in virtual simulation pedagogy, explain the virtual simulation companion guide, and discuss some strategies for curriculum integration. I want to acknowledge the project team. And so the project team included Joanne Perazzo and myself from McMaster, Jane Tyerman from Ottawa, and Marion Lucart Flood, sorry, from from the University of Queens, Cynthia Baker, Shima Ayatullah, Christine Crosby, and Devin Crockett from COSN. I wanted to especially thank our two Canadian gurus, I have said, in virtual simulation, that is Marion and Jane, who guided us through this development process. I want to acknowledge the Public Health Nursing Advisory Committee. And this advisory committee included public health educators from 10 universities and colleges across Canada and 2 public health units in Ontario. Many of the public health educators are involved with the COSN Community Health Educators Interest Group. And also, I want to acknowledge all the content developers for each virtual simulation game. As you can see, there are 5 to 7 people involved in each game. The content developers were members from the advisory committee, and I'll go into their role later. And also I want to acknowledge the technical reviewers who were French-speaking public health educators who reviewed all the translated content developed for each game and the companion guide. In addition to the content developers for each game, there was a team of public health nurses from the Toronto Public Health and the City of Hamilton Public Health units who viewed the public health content to ensure validity and currency. Last but certainly not least were the amazing actors who were the stars in bringing the reality to the virtual simulation games, and Connor McLean, an experienced and professional videographer. The actors included various roles, including public health nurse, parent, youth, and reporter, who happened to be my daughter and son-in-law and grandson, and various community members and students. There were 14 English actors, and we had 14 French actors using voiceover. So to begin with, to give a brief highlight of what the evidence says about virtual simulation and what it is. Virtual simulation is defined as a computer-based learning activity that includes a realistic client case study, an activity requiring knowledge and application, and a learner's engagement in the role of the care provider. Virtual simulation games represents one type of virtual simulation. Several theoretical frameworks informed their creation, including Cobb's experiential learning theory, Knowles' adult learning theory, constructivism. Prior to the pandemic, virtual simulation in community health nursing situations was very limited, especially in public health. Most virtual simulations were in acute care nursing. Studies indicate that participation in a virtual serious game is effective in developing clinical judgment among nursing students. Virtual simulation games also enable students to use previous knowledge and build new knowledge as they reflect on the reasoning and on their resulting decisions. Studies indicate that the achievement of learning outcomes through virtual and in-person simulation are comparable, and in some situations, virtual simulation have been found to be effective. An evaluation study was conducted comparing real-life clinical experiences in public health nursing with virtual simulation using Sentinel City 3.0. There has since become a Canadian version. And student learning outcomes are found to be comparable, and there are higher confidence in achieving learning outcomes among the students in the virtual simulation game. Why focus on public health? As noted previously, there is a dearth of virtual simulation resources for community health nursing, and especially public health nursing. This became a glaring reality with the pandemic. To address the gap in public health virtual offerings, 3 serious games presenting an unfolding case study focused on community assessment, health promotion, and program planning were created. Hence, the project goal was to improve the quality of public health nursing education in Ontario and across Canada. So step 1 in the project was game development. Let's begin with this brief advertisement of the game.
Are you looking for a way to keep nursing students actively engaged in developing their public health competencies?
I'm worried about the kids in the breakfast and lunch program at the school, though, and whether or not they'll have access to regular healthy meals while school's out for the summer.
We have 3 brand new virtual simulations designed to do just that. And the best part is that they are completely free and designed to be accessible for students. We call these simulations games because they are designed to be interactive and engaging. Students can play them anywhere and learn by making mistakes in a judgment-free, safe space. In each game, learners make decisions about which framework is appropriate to guide their decisions. During the community assessment game, students decide where they should gather data from about food insecurity, how they will analyze the data, and report their assessment.
There aren't any grocery stores nearby. There is a neighborhood services organization in the neighborhood. We need to talk to the staff in that neighborhood services center.
In Game 2, they are looking for health promotion strategies to address food insecurity. Learners collaborate with clients and community partners, decide which actions are evidence-informed, and implement and assess their interventions. Then, in Game 3, learners get to take part in developing a program to address the food insecurity in collaboration with the community. We have even integrated Select All That Apply questions to help them develop critical thinking skills in population-based nursing. Rationales for each decision reinforce key learning objectives. Students say these rationales are the best part of the entire experience because it helps them learn in the moment. These games are designed to build on each other. They come complete with a companion guide for educators that introduces you to the content, simulation best practices, a list of suggested preparation materials to help students get the most out of the simulations, and a self-assessment rubric. You can even track their completion of the games by asking them to submit the certificate they get after completing the game. That means you could give them grades for completing the games if you wanted to. Click on the link below to learn more about how to easily incorporate these high-quality simulations into your community health course. This game would not have been possible without funding from the Government of Ontario through eCampus Ontario, who is investing in a virtual learning strategy. By collaborating with experts from the McMaster University School of Nursing, in collaboration with the University of Ottawa, Queen's University, the Canadian Alliance of Nurse Educators Using Simulation, and the Canadian Association of Schools of Nursing, we were able to create a comprehensive educational resource supporting students to apply essential knowledge related to public health nursing.
You will notice on the website, each of the games are identified here, and there's the English version and the French version for each of the games, and then the companion guide, which I'll go into. That gave you a little insight into what I'm going to be talking about. So just to give you some of the story of our journey in this experience, just so you can get the extensiveness of the involvement that we all had, is so in the development of the 3 games, the focus of the game was on the community health nursing process. So in game one, we looked at community assessment. Game 2, we looked at health promotion, and game 3 on program planning. These 3 areas of knowledge, skill, and attitude were identified to align with, as I mentioned, the community health nursing process and also cause and public health nursing competencies. Our first step was establishing a storyline that considered several guiding principles. Some of these included the complexity of public health nursing, population health context, a neighborhood approach, a policy component, relationships and collaboration, multiple concepts of health determinants, health equity, social justice, diversity, and inclusion, and that the client was from an individual, family, group, community, population, and system perspective in that level of practice. Important to recognize the level of the learner, focus on an urban context with application to a rural context, a need to consider order and sequencing of the games, and to create an unfolding continuous storyline through the 3 games. And lastly, as I mentioned, to integrate the cause and competencies. So with all those guiding principles, the Public Health Advisory Committee decided on the population health issue as food insecurity. The storyline was a public health nurse has joined a team of public health nurses and needs to understand the population health issue of food insecurity on an urban neighborhood to inform the development of health promotion approaches that promote food security for vulnerable client populations. Many members of the Public Health Advisory Group became the content developers. With the guidance of Jane and Marion, each of the games were developed in a concentrated period of time over a couple of days, including 8 to 10 hours in a 2-week period. That's intense. Though it was very intense and was during the summer months, we did have some fun through that. Given it was an unfolding food case study of food insecurity, we developed the games in a sequence from game 1 to game 3. Each game became a succinct case study, case summary. From the case summary, there were 3 steps to develop. Step 1 was the learning outcome. Step 2 was a decision point, and step 3 was to write the script. Over the next few slides, I'll describe the comprehensive evidence-informed process used by CanSim to develop virtual simulation. For those of you who have developed curriculum, this will be familiar. We need to start with the end by identifying the learning outcomes, then work backwards. In other words, we needed to develop 3 to 4 statements that tells what needs to be demonstrated, the when and the why the end of the learning experience. And in this case, the game. An example of game 1 for community assessment. The what was analyze the information gathered. The when was from the community assessment, and the why to identify strengths and needs related to food insecurity. So that would how the learning outcomes would look. These learning outcomes then became part of the self-assessment rubrics. There is a self-assessment rubrics for each game for students to evaluate their own performance. A scene was described, the critical thinking question identified with 3 responses. 1 was correct and 2 was incorrect, if that was the kind of question we chose. For each response, a rationale was provided to enable students to understand their response. For each game, there was 9 to 11 decision points. The critical thinking questions could also be multiple select when there could be more than one correct answer, and this was mentioned in the trailer. Here's an example of a learning outcome. Identifies an appropriate tool for community assessment to use in a systematic approach in assessing food insecurity. And the decision that the students needed to make related to this learning outcome is what is the most important tool for a systematic approach in community assessment to assess food insecurity. And only one is correct. A rationale is provided for each answer. Then step 3, after the decision points of each learning outcome for all the games were identified, including the scene, questions and answers, and a rationale, then we move to step 3. In this step, the content developers wrote the filming script, focused on the dialogue between the actors and detailed filming instructions, such as the setting, including equipment and props, acting direction, including tone, mood, and movement. After the script was completed, we conducted a peer review process by 6 different public health nurses for each game. The purpose of the peer review was to ensure the content was accurate, relevant, and any grammar issues were identified. Once the peer review was completed, the scripts for each game were translated into French. To ensure accuracy, we then had French translation, and we had 2 French-speaking public health nurse educators complete a technical review. When all the scripts for all 3 games were translated, then the filming occurred. The experienced videographer recorded every scene separately with the identified actors. There were 5 separate video scenes recorded for the 3 games. As noted earlier, there were over 28 actors, 14 English and 14 French. And we used voiceover for the French actors. When the filming was completed for all the games, Jane mobilized her team of experienced students used by CanSim to do their magic in assembling the games, and that they did. So I just want to stop briefly to see if there's any questions anybody has, and then I'll proceed to talk about the game. So I'm just going to come out of the stop sharing and see if there's any questions that anybody has, and then I'll go into the companion guide.
Ruth, there is a question in the chat, and I'm going to read it to you. This is great. Congratulations. Do you plan on doing more games on other public health issues such as prevention and control of infectious diseases?
That's a very good question. There is so much we can do in public health, as you can fully appreciate. This is the start. Of course, as you know, we've got funding through eCampus. So I think there's wonderful opportunities in the future if there's eCampus opportunities. And this is not new. eCampus does, I think, this annually. So that if there are other public health nursing educators and practitioners keen on moving this forward, then I would strongly encourage them to seek funding to do that. So at this point, there isn't anything else planned, but yes, definitely something on infectious diseases, but we could go on to many different ones. Good question.
Thank you. And also in the chat feature, Marion is putting CanSim is collaborating with a group. Gosh, it moved on me here. So collaborating with a group in the University of Calgary to create a series of virtual simulation games on vaccine hesitancy. And Kim has also asked, is this tool available? Gosh.
Is this available yet?
And if so, is it located in the open access or the members only?
Open access.
So I'm just quickly showing you, Ruth wasn't able to show the full scene. So this is the public health nurse website that are going to house all of the games. So the first game is community assessment. There's both the fully English and fully French version with the companion guide that Ruth is going to talk about in a minute. And so really this is an important one because it talks about how to do a windshield survey, how to gather lots of different data. And it's with a team of public health nurses at a round table having the discussions on what are the key issues. The second game is the health promotion. So after completing the assessment, reviewing the food security report from the City Social Planning and Research Council, they meet together at a nursing roundtable to look at some health promotion. So again, English and French versions. And then finally, game 3 is the program planning and evaluation, where they develop a food security program using all of the information that they've received from the evaluation and using a logic model. The public health nurses in collaboration with the community develop this program planning. So you can see that it's got a dedicated site for everything that you will need for the public health nurse.
The question is, how long did it take you to develop each game?
Well, as you can see, the funding was for a full year. So we've been working on that fairly steady starting back last, I guess, April. And so I explained all the various steps, the 3 steps. So that was a very intense process starting, as I said, in May, right up until January this year to be able to complete all these components. So it was several months, obviously, for that period of time.
Then Ruth, I'm just going to invite you to carry on for the second part of it. Thank you.
Okay, thanks, Leslie. So, good question. So moving on, the step 2, so after we completed the games, we then wanted to look at a companion guide. And the companion guide, the purpose of it is really to provide educators with the resource to assist in promoting optimum learning when students engage in public health nursing virtual simulation games. Recognizing that many educators who've been involved with community health nursing education, as I mentioned earlier, have not been involved with virtual simulation. It's very common, as I mentioned, in acute care. So we really thought it was critical that we have a companion guide to support your role as educators in using these virtual simulations to have the best learning experience for the students. So in this guide, there is a literature review, and I just touched on it earlier in terms of what the evidence says about virtual simulation. That also includes the best practices in virtual simulation, optimizing simulation-based learning, then a toolkit of strategies to optimize learning, and the mapping of the cause and public health nursing competencies to each game. Though the actual virtual simulation game only takes about 20 minutes of a learning experience for each game, it is more than that because it includes also the need for pre-brief and debrief time. And so that adds to more time in the learning experience that the students would have. So in 2011, the international, just to highlight optimizing what we wanted to really bring forward in optimizing simulation-based learning was what is the best practices on simulation. So in 2011, the International Nursing Association of Clinical Simulation and Learning, which many of you are probably aware of, and AXL, but this was new to me because for many of us in community health nursing, we haven't been involved with this area of education to really know there's clearly some best practices that exist. And so in 2011, they did develop them for in-person simulation. The recent version of these standards were released in 2011, and they expanded these standards to include in-person and virtual simulation. There are 10 standards which are outlined in the companion guide. The 3 that were applied most to the virtual simulation games were pre-brief, facilitation, and debriefing. Pre-brief is a process that occurs prior to the learner's engagement in a simulation experience and includes preparing learners for the educational content of a simulation and making them aware of the general ground rules in order to establish a psychological safe environment. The pre-brief involves the activities such as the review of the learning objectives, orientation to the learning environment, technical information needed to optimize the gameplay. Pre-briefs occur usually immediately prior to the simulation to orient the learner with instructions of information to support optimal learning. So really important for faculty to go over the pre-brief with all the students before they move into the games. Facilitation, another best practice, refers to the use of varied methods to guide the participants to work cohesively and comprehend learning objectives and achieve learning outcomes. This is particularly important in community because many community placements are in the context of a group and not often a precepted environment, which unless you have it in a 4th year, but many community health nursing courses are in a group environment. Hence, facilitation is critical in the skills in how to facilitate a group in the pre-brief and the debrief. Facilitation methods may differ when students in a simulation interact individually within a virtual learning environment rather than in a real time with a facilitator and other students present. The facilitator's role, however, is in both situations is to foster skill development, critical thinking, and application of theoretical knowledge to the practice situation. The debrief includes the requirement that there is a planned debrief process following the game. That includes feedback, debriefing, and or guided reflection. And that's some of the reading I've seen is up to 4 hours from the experience of going through the game. Debriefing is a key practice in fostering student learning and an essential component in virtual simulations experience. Sawyer and colleagues argue that it is the most important in fostering learning. The goal of debriefing process is to assist in the development of insight, improve future performance, and promote the transfer and integration of learning to practice. Several debriefing models have been developed that provide educators an organized structure to guide this process. There are 3 debriefing models described in the companion guide and 1 model applied to each of the games with guiding questions. So the 3 debriefing models described in the companion guide are the 3D model, the 3-phase debriefing and good judgment model, and the multiple phase model. The 3D model uses diffusing, discovery, and deepening to inform the debriefing questions. This model is based on Cobb's experiential learning theory. The learner moves through these 3 stages of debriefing while gaining new knowledge that can be applied from the psychological safe environment to a future practice setting. The learner recognizes their learning gaps, identify new learning, and then examine how the new learning can be applied in the action. The 3-phase debriefing with good judgment model describes debriefing as a rigorous inquiry process in a psychological safe climate between the learner and the educator that creates good judgment. The process for achieving this goal usually follows a series of steps, such as processing reaction and analyzing the situation, generalizing to everyday experience, and shaping future practice by lessons learned. The last model, multiple phase model, describes debriefing through a series of 6 steps that enables the student to share their virtual simulation experience during action, and then during a period of reflection on their actions related to outcomes and their possible meanings for clinical situations. In the toolkit of strategies section of the companion guide, each game is described. That includes the case summary. I think Jane just walked through you some of the case summary for each of the games that were on the website, and this same information is in the guide. There's the learning outcomes for each of the game, pre-brief strategies, debrief, and self-assessment rubrics. The pre-brief strategies, just to go through what that includes, prepares the students, as I mentioned, for the learning experience and sets the ground rules. So it clarifies the educator or clinical instructor's role, reviews the expectations of the learner, including the preparatory readings required, the learning activities to be completed, such as some key terms. And there are a number of key terms that are identified likewise in the companion guide for each game. It provides instructions on participating in the virtual simulation and discusses the format of the debriefing. In the pre-brief, there are also relevant readings from different Canadian community health nursing textbooks for educators to select the readings used in their curriculum. For example, Game 1 involved with community assessment. We have identified chapters in the 3 different community health nursing textbooks. For example, Stamler, the Community Health Nursing, a Canadian Perspective, and also Volman and Jackson, and that's a Canadian Community as Partner, Theory and Multiple Disciplinary Practice, and Stanlaw, a Stanhope, in Community Health Nursing in Canada. And we really felt it was important to recognize that all those textbooks are used across Canada, and then recognizing that all curriculums use all 3, obviously. So I think we wanted to be sensitive to what potentially are the most common textbooks used, and hence why we included those readings. We also included other relevant readings and sources for each of the games. And so you, as an educator, can select what you want. The last section, as I mentioned, in terms of the debrief, the goal of the debrief is to advance the development of insights that the students will gain in doing the games, improve their future performance, and transfer simulation-based learning to whatever practice. And the one model that we used and applied to each of the games is the 3D debriefing model. But that doesn't mean you can't choose another model and use that. Again, this is just a resource, and it's your choice as an educator. The student self-assessment rubrics with a Likert scale offers the students an opportunity to quantify their perceived competence in meeting each learning outcome. It also provides a little more flexibility to self-rate their knowledge. As noted, the companion guide in one of the appendices goes through the Kaizen Public Health Nursing Entry to Practice competencies, and they are mapped to each of the games. So I'm just going to again open it up, and then if there are any questions, but I also just wanted to leave points of discussion if you want to move into this. So I'd love to hear from you too, in terms of how you see these simulation games could be integrated into your curriculum. So I'm just going to stop sharing and open it up for any questions that you might have in regards to the companion guide, and then also how you think you might be able to use this. So.
Thank you so much, Ruth. And I'm just before we get into the questions, I was just going to call upon Dr. Luchterflug to talk about the INACSL standards. You had commented on them, and as the lead of the INACSL standards, Marian, can you just give us a quick summary of the standards?
Can you hear me?
Yes, you can.
My microphone's been going on and off all day. So I guess the comment I want to make about the standards is that they are applicable to both in-person simulations and virtual simulations. And so you still need to have all of the components of a good simulation in place, such as pre-simulation preparation, pre-briefing, and of course the debriefing. And so sometimes people say, oh, we need a standard for virtual simulation. We don't need a standard. Maybe we need some guidelines, but to support how to implement, but we still operate under the same standards. And what that means is you need facilitators that are trained, that understand simulation principles, that have had some sort of training, such as the Kaizen training, and Axel has an education course as well, and particularly for the debriefing phase. So you want debriefers that are not only content experts related to community health nursing, for example, for this scenario, but also those that know how to implement debriefing. And so we have suggested several debriefing methods at CanSim that can be used with virtual simulation. We also have a module for facilitators on debriefing virtually, and it uses the debriefing for meaningful learning format, which is Chris Dreyfus. And we do have a webinar about that model. And we also have a virtual simulation game for facilitators to play to become immersed in how to do a debriefing virtually. And the same principles can apply often to in-person debriefing, but a virtual debriefing, when you're in a situation like this in a Zoom land, and some people have the cameras on and some have them off, some tips to help you to engage your learners during a virtual debriefing. Did I answer your question, Leslie?
You did, Marian, but just one thing of clarification is that when were the last standards published, and what were some of those changes?
Okay, so we did have updated standards published in 2021. And one of the changes is that the title has been changed to Healthcare Simulation Standards of Best Practice. And that is to reflect the fact that these are appropriate for interprofessional groups of educators and students. They were created from interprofessional literature as well as international literature. So the new standards were there in 2021. Some of the new standards that have their own standard now are the pre-briefing and preparation. What was the other one? I think the faculty development was a new one as well. So there's about 10 standards that you can look at. I would say the design and facilitation would be a key one, the pre-briefing and debriefing to get you started if you're not familiar with the standards.
Great, thank you for that. And so now back to Jane, go ahead.
Yeah, and that's just one of the things how we built with our team, with Ruth, is that we built these modules. It's not just this virtual simulation, it's the module that includes all of the standards of best practice, such as the pre-simulation preparation, the pre-briefing, the evaluation, the virtual simulation. That is all AODA accessible, the reflective questions, and the post module evaluation. So we were very much following the standards of best practice as we were going through this process.
Thank you. And so back to Ruth's question, how would you plan to integrate this into your curriculum? Now, I don't see any hands up. Is there any that I'm missing?
So I can suggest one way that I would love to incorporate this. When we're doing our community placements, not all of us have the capacity to have all students go into a community setting. So as we teach the theory about a windshield survey, they can get the concept from the textbook, but actually to see it in action and have that unique opportunity to be a member of the public health nurse team is really an exciting opportunity that these games provide. So it actually, with Ruth and the team of public health nurse experts that really led the development of these projects, it really is immersing the learner in the role of the public health nurse so they can see each facet of the community assessment, the health promotion, and the program planning and evaluation. The correct answers are all the best practice standards, but the not best and incorrect are common misconceptions and errors that you see in practice. So it helps to guide the learner into adhering to the best methods of engaging within the community for this community assessment. What I really like is that the decision to do food insecurity, especially for children, is such an important topic that is something that's really highlighted as one of the key issues that were being faced within many, if not all of the communities in Canada. So I think that this targets really an important need, and I'm very excited to be part of that process. So congratulations to Ruth for selecting that topic.
Well, it was the Public Health Advisory Committee. I see Laura has her hand up.
Hi, thank you. It looks like my camera doesn't want to work at this time, but I was talking to a colleague of mine about these games that were coming out, and she's very excited about the possibility of the games. And I think there's a possibility to assign small grade percentages for completion of the certificates, and then the games can be discussed in a class. So you can use it in that way to flip the classroom, if you've heard of that terminology before. She's also designed exams, open book exams in her class, where she has her students doing some of the stuff that you're doing in the games. So I think that another possibility might be not to ask the exact same questions that you're asking in the games, but to develop some other open book testing questions based on the games that are contextualized in her course. And then she could assign that. And because it's free for all the students to use, you don't have that ethical conflict of asking students to buy a commercial product in order to be able to complete the exam. So I see lots of possibilities there. I think she's still wrapping her head around exactly what she wants to do with it, but lots of options.
Mm-hmm. I could see you also doing it as an assignment outside of class as an application, and then uploading the certificate and giving them marks for that. But I could also see it being completed in a group setting by the teacher, and going through each of the questions and talking about why answers are correct, but also why answers are incorrect or not the best. And then engaging the students in a discussion on how they can apply the concepts that they learned within the virtual simulations into their own clinical practice if they were public health nurses, and engaging in them with, we did food insecurity, but what are some other issues that are really a community concern in your area, and how could you potentially adapt what you've learned into that setting?
Good ideas.
Yeah, Sophia Turner said seeing the incorrect answers are almost more powerful for the learning of the students than the correct answers. And I agree. And when we first started making the games, we didn't give rationale why the answers were correct initially, because we felt that the students got the correct answer, they must know. And it came back from the very first project that we did that they said, can you tell us why the answer is correct? And I thought that that was really an important piece. So, you want to make sure that they understand why the answer is correct or incorrect.
Yeah. Good points. I see the comments being made in chat in terms of the importance of role playing incorrect behavior, that we need to be careful that, how we do that. So the students are indeed recognizing this is the best way and this is maybe not the best way. And I think those are opportunities that you have as educators in going through. Now, how do we work with the community? Is this something that we would be doing? And so I think it's wonderful opportunities that you could use as a springboard to some of the content covered in each of the games and that. So, and yeah, food security is such a common thing. And as you heard me say, the guidelines that the Public Health Advisory Committee really felt were important was something that could be applied in many settings and many situations, be it urban, be it rural. Um, and because we know food security has affected many, many, many people and in many walks of life. And so this has some really relevance both now and ongoing, because food security is not a new issue. It's an issue that we have in public health for many years. But it really gives the students an opportunity to look beyond just having healthy food and really looking at population based health promotion approaches. Um, so, yeah.
And one of the things that we do with the not best answers or incorrect is we really show why that's not the best, on top of providing that rationale for the students or the learners to understand, gain a deeper understanding of why that may not be the best response.
Yeah. And I think the other point that Sophia is recognizing is that breaking down some of the stereotypes, and that can happen in some of the incorrect answers. And so that's great. Yeah. Yeah. So there's a lot of opportunity in really using those incorrect answers as a learning opportunity. Good. Laura, do you have your hand up, or is that you just haven't got it down yet? I didn't want to miss it if you really did have another question.
Sorry, no other question.
Okay.
Ruth, a question: how long did it take to create the simulation?
Yeah, as I mentioned, it took us several months, almost 6 to 7 months. I think it really concentrated, but the actual content, as I said, when we met as the three teams, by the time from beginning to end, it was several months, because we had to go all through those 3 steps. So it's quite comprehensive. And of course, there was 3 of them.
Yeah, I think for the writing, we took 4 days per game. And then we had Ruth hired a special photographer. So I don't know how many days it took you to film. I think it took a couple of hours to film the second and the third game. The first game was a little bit longer because they did the windshield survey. So with our process, you can create a game in about a week, but we spread it over and we did peer evaluations. Then we translated into French, and then we created the games in the French language also.
Which required more time.
Yes.
Yeah. So in the interest of time, and I can see that this has been such a fascinating topic, and there's lots of discussion, but in the interest of time and keeping this on schedule, I'm going to stop the comments now, unless the co-presidents would like to make a final parting word.
Sure. So we just really wanted to thank everyone for joining us on the webinar. We are thankful to Ruth for doing this presentation, representing both all of McMaster University, Queen's University, and the University of Ottawa, and CAUSEN that collaborated on this important initiative. So thank you for taking on the lead for this presentation, Ruth. The website will be open. It'll be open access, so you can get all the resources as soon as eCampus releases that, which I would hope it'll be by around May 1st. May 2nd.
May 2nd, I think.
Their open house.
Yes, and you'll find that our website is now live. We are finishing filling up all of the games. So I think we're at about 90 or 100 games right now, and we'll put the remaining 62 up in the next week or so. We welcome you to join CanSim. We welcome you to join the Simulation Interest Group, and we're also moving towards creating an awards where you can get some research scholarships if you are a member. So we are dedicated to furthering the science of simulation in Canada and internationally, and we look forward to potentially seeing you in the future.
Thank you for that, Jane. And Ruth, thank you so much for this very interesting presentation. It really gave us some insight on how to teach some complex public health competencies in a very interactive way. So thank you so much for the presentation today. Folks, if you could expect an evaluation to be sent to your email, we appreciate the feedback. Thank you, everyone. Bye now.
Bye, everyone.